Health Matters with Karen Key.
Well, aphasia is an acquired communication disorder caused by a focal injury to the brain that affects a person's ability to communicate. It's most often the result of a stroke. Now, individuals with aphasia may have difficulty expressing themselves when speaking, difficulty understanding the speech of others, and difficulty reading and writing. Dr. Glenn Goldblum is the founder and coordinator of conversational groups for individuals living with aphasia and cognitive communication disorders in the Department of Communication Pathology at the University of Pretoria. And Dr. Goldblum joins me on the line now. Good evening, Dr. Goldblum. Welcome to the show.
Good evening, Karen. Thanks for having me.
I think I've given a brief explanation of what aphasia is, but could you just give it to us in a little more detail exactly what is aphasia?
Well, I think you did pretty well. I think that it's an acquired communication disorder that often caused by a stroke, where people can have variations of communication difficulties. They may have difficulty expressing themselves when speaking to a greater or lesser extent. They may have difficulty understanding the speech of others, difficulty reading and writing. But the one thing that I do want to stress above this is that people with aphasia, even if they've got very limited or no communication, are still intelligent and competent individuals who have the ability to think and make decisions.
I think that is a very important point, because once somebody is unable to communicate, people automatically think that there's more than just that as the problem.
Exactly, and I think that often the aphasia masks their intelligence and their competence, and society generally tends to be very afraid of disability, and they tend to hide away, particularly from people with communication difficulties. They don't know how to talk to people with a communication difficulty, so they rather isolate them and kind of ignore them and push them to the side. And a lot of the focus of the work that I do now is focusing on the kinds of barriers and obstacles that exist for people who live with these kinds of difficulties and can't, confront these obstacles in their everyday lives, where people are ignoring them, they're regarding them as stupid rather than, competent human beings. So we need to do a lot more educating, and that's why I'm so grateful to be invited tonight, because it's an effort to try and remove some of these barriers.
But the thing is, we all need to start understanding about conditions like this, because I was reading some quite frightening statistics. I read that more than 100,000 people acquire this disorder each year, and it's more common than Parkinson's disease, cerebral palsy, or muscular dystrophy. So it's not an uncommon condition, and we need to kind of get over ourselves and just start understanding what it's all about.
Absolutely. You know that the statistics, obviously, for example, in the United States are much more, firm, and there they say that about 1 million people exist in the USA with aphasia. Here in South Africa, statistics are very hard to come by. We sort of know that around 5% of our population are reportedly disabled, and an estimated 0.4% of our population has got aphasia, but these are very broad estimates. But the fact is that there are a lot of people out there who have communication difficulties, and right the way down, from professionals through to lay people, have real difficulty understanding some of the barriers that these people face.
The thing with aphasia as well, Dr. Goldblum, is that it doesn't just affect sort of one segment of the population. It can affect anybody across the age range, across the racial, gender. I mean, it sees no barriers. It just can affect anybody.
Absolutely. And, while it's more common among older people, and it can really occur in people of all ages, nationalities, and genders. It really can.
Is this something that you can recover from? And if so, how long would it possibly take if it was going to recover?
Well, if the symptoms of aphasia, usually within the first 2 to 3 months after a person's had a stroke, they can make significant, if not total, recovery. Any time thereafter, after that period, recovery continues to take place, but at a slower rate, let's say within the first year after the stroke. But in my experience over the years, I've really seen how people can continue to improve over years and even decades. I work at the university with people who've had their strokes 20 years ago, and sometimes I have to kind of shake myself when I think that the way this person is speaking, who didn't used to speak like that last year. So it's also about becoming more confident to participate and to communicate in spite of having communication difficulties. And I think that ultimately that's what we work towards. Once you've got past the period where people can really improve completely, then the focus becomes on helping the individual with aphasia and very significantly their significant others, and that might be their family members and everyday people in their lives. It could be their colleagues at work, their peers, to accept the difficulties and to learn to kind of compensate for the difficulties and get around them. And what you find is that people tend to be immensely resilient, and that life goes on in spite of having often very severe difficulties. And I work with remarkable people. Some of the people who've been in our groups at the university have been there for many years, and they display this amazing resilience. They might have been professionals before their stroke or had all kinds of careers, and yet life carries on with a great quality of life in spite of having communication difficulties.
Now, it's quite important that people should receive some sort of speech therapy quite soon after the stroke.
Yep.
How soon after the stroke? Almost immediately?
I think ideally people should receive speech therapy immediately after the stroke. Obviously, this is in an ideal situation at the bedside while they're recovering in hospital. And this therapy should ideally continue when they go home or when they're perhaps in a rehabilitation hospital afterwards, and in conjunction with other therapies such as, physio, occupational therapy, whatever the other therapies are. And at this point, early on, therapy will focus on complete recovery, maximizing the recovery that is possible with this person. But as time goes on, the focus of therapy changes, and it becomes more about helping the person to compensate and educating and informing the everyday people and the significant people in their lives so that they can support this person. Because at the end of the day, I've really learned that a person with aphasia will never succeed unless they've got networks of support in their everyday lives who can support them in whether it's at home or whether it's in the work context or whatever context it is. People need to be informed, they need to be educated, and then they can provide the support that's necessary and try and lessen the frustration that's there.
Another form of support, though, is something in this conversation group therapy.
Yes.
And that's actually being able to be in therapy with other like-minded or like-afflicted, if you like, people.
Yep.
You can, first of all, it's a great thing if you're in a situation to know that you're not alone, so that there are other people that they understand what you're going through. I think that's a lot of the recovery as well, is just that other people understand, because as you said, the family needs to be helped to understand, whereas someone in that same position is going to understand immediately what you're going through.
Exactly. I started the conversation group for individuals with aphasia and people who've got cognitive communication disorders. That's another topic. Those are different communication difficulties after head injuries. At the University of Pretoria in the speech therapy department 17 years ago. And today we've got about 21 members in our groups being facilitated by final year speech therapy students. And the group has become a family for these members. Some of them, I've got 2 members who are founding members. They're still there for 17 years.
Wow.
And we embark on lots of projects. The philosophy of the groups are very much about empowerment and advocacy and living with aphasia and trying to educate the public and to lessen the barriers that exist out there. And we do lots of projects both, within the group. We also are involved in projects with colleagues in America, doing some collaborative projects with people with aphasia in San Francisco and in Michigan. And it's been amazing, actually, what, for example, the world of technology has offered these people in the last, 10, 15 years, where previously they were completely isolated. We use technology very much as an integral part of our group therapy and the projects that we work on.
And just very briefly in closing, a few points on how you communicate with somebody with aphasia. I think you need to, first of all, learn patience, because I'm sure a lot of people might become frustrated if they're trying to communicate with somebody who isn't communicating back. So what are some tips for people who are trying to communicate with somebody who has aphasia?
Okay. I think the first thing is to respect them and to regard them as an adult and not to, talk down to them. I think to, give them time to speak and don't finish off their sentences. If necessary, you might need to simplify the communication. You also might need to reduce your own rate of speech to be understood. Most importantly, I would recommend using other modes of communication, like writing or drawing, or simplifying even down to yes-no responses. Giving them time to talk, and really encouraging people to be as independent as possible and trying not to be overprotective towards them, and not shielding them from the world outside and hiding them away because they're an embarrassment. Maybe rather kind of sharing with the world outside that this is a problem and this is how my wife or my mother or my whomever speaks like this, and this is how best you speak to them, and including them. And it's incredibly empowering for both the person with aphasia and for the people in their environment to be given this kind of information.
Just very briefly to tell you, a couple of weeks ago I interviewed some people from an organization called Tiny Hands,
yes.
And they teach people, I would imagine in this position, very basic sign language so that
yes.
they can initially communicate. And that's another way, if somebody's wanting to do that, very basic hand gestures, if you're able
yes.
to.
Hand gestures, or there are communication devices. There's a whole world out there of augmentative and alternative communication where people use, machines that actually can talk for them. I've actually got someone in my group who uses what they call a light writer, he types in the sentences and it talks for him because he can't talk.
As you said, the technology sometimes gives us grey hair, but a lot of the time it's really good.
Well,
and this is one of those cases.
As a tool, I think it's incredibly useful. It's not a magical be-all and end-all kind of thing. It has to be a part of a tool used with a professional therapist.
Dr. Goldblum, thank you very much indeed for joining us on the show this evening and for giving us some more information on aphasia. I hope those listening it's been helpful, and hopefully we've all learned something.
I hope so.
Thank you so much for joining me on the show.
It's been a great pleasure. Take care.
Dr. Glenn Goldblum is the founder and coordinator of conversational groups for individuals living with aphasia and cognitive communication disorders in the Department of Communication Pathology at the University of Pretoria. For more information on therapy services, you can contact the South African Speech Language Hearing Association for names and numbers of therapists, and you can call them on 086 111 3297, 086 111 3297, or by email admin@saslha.co.za, admin@saslha.co.za. And don't forget, if you miss any of these details, you can email me on healthmatters@safm.co.za.